Hello guys, good morning and how are you doing? Welcome again for us to continue with one of the sessions we are currently doing for the newly introduced stations in Osce by NMC as from this, most probably this month. Now we are doing the Bowel assessment station, and earlier on we had worked on the type 1 and type 2 types of stool. Now in this case we are going to deal with type 6 and type 7 of stool according to the Bristol stool chart. And in this case you will still meet bowel movement record, and it looks like this one, whereby you have the date, the time, the comment section, the types of stool, and at the extreme end you have your staff initials. Now the first bit contains the patient particulars, and all this will be pre-filled in your Osce, so you need not to be worried that much. The assessment comes in two sections. There's the section of recognizing the stool type, then there's the section of proposing a plan of care for this patient. Now for this case we are going to deal with type 6 and type 7, and you will be given a photo of stool type and you are supposed to identify it. So in this case what you might expect would be a photo like this, and this a type 6 form of stool according to the Bristol stool chart. And just because it contained like some fluffy feces with rugged edges, as you can see, and it's more of like a smushy stool. Yeah, it's not entirely watery but contains some slightly solid forms, and that signifies diarrhea in this case. Another picture or another photo that you might be provided with is a type 7 photo, and this the picture of what you might encounter. The type 7 form of stool is entirely watery. There is no solid piece and is entirely liquid. It's something like has poured on the floor, so that's the easiest way to recognize it. The hallmark is you should recognize that either of the two photos indicates diarrhea. So in this case, after being given a photo, you will only be given one photo anyway. So that photo will be given, and we can work with the type 7 one for this scenario. And after recognizing that this is a type 7, what you will do, come and record all that one in your bowel movement record chart. In this case, I'll start by this. On the date, I'll put the date of regarding my examination. So I'll put today's date, which is 13th of September 2022, and under time, use the time that you are given in your assessment. You can be told, assume you are doing assessment at 2 p.m. or 14:00. Right there, 14:00. In terms of the comment section, that's where you recognize the volume of the stool, and since it's a photo, that part might be exempted, but still you can give it a rough estimate because it's just an estimate. For this case, I can consider this one to be small, so I'll put S to mean small under that section, or just write small. Then I'll go ahead and tick type 7 at the extreme end, yeah, at this section. Then at the end, I put my initials, the staff initials, VO, to recognize the fact that I'm the one who did that assessment. While you are done, that will mark the end of recording on this chart, and that will give you a pass. That's the first bit of the assessment section. The second bit will be the part of developing a plan of care for this patient, a patient who is having diarrhea. First, you need to recognize the situation this patient is in. So in terms of your submission on plan of care, you will state that the photo indicates type 7 stool form, and this indicates diarrhea. There is need to prevent diarrhea for this patient, and that will help in terms of patient's well-being and all that. Also, I'll state that diarrhea can be caused by things like food poisoning and malabsorption. There are several causes, but if you recognize two, you will be okay. So I'll state that diarrhea can be caused by things like food poisoning, things like malabsorption, and maybe leave it at that point. And since it is diarrhea, my next point will be revolving around IPC. There is need for infection prevention and control, and this can be done through isolating the patient and also sending the stool sample for culturing. There's also need for the patient to reduce things like fruits and vegetables, which can irritate the bowel further and worsen the diarrhea, and that will fall under dietary advice. There's also need to stop this diarrhea in case it's not infection related. So in this case, there will be need for prescription of antimotility medication to ensure the diarrhea is contained. The patient is losing a lot in terms of water, so there will be need for rehydration, and this can only be done through increment of fluid intake and water intake, or any fluid intake that will kind of compensate on what the patient is losing. You just need to frame your statements both to capture what is needed, but also be concise enough to permit you of the time for the procedure. The next element will be there's need for the patient to adopt like positive toileting habits, and this would entail things like privacy, positioning, and also spending sufficient time while going to the toilet to ensure sufficient opening of the bowel. There's also the aspect of need to continue observing the bowel movements, as this will guide the next form of action, and also determine whether the actions you are taking are really yielding any success or any fruits. In that case, you would have covered at least 8 of the plans, 8 of the points that need to be considered in your plan of care. Now, you only need 5 points to pass that section. Yeah, the 5 points, you can categorize them the way you want. They come either in form of determining the cause, dietary advice, prescription, hydration, need for things like continuous assessment of the bowel, positive toileting habits, and things of that kind. It will be the same. It will be the same for both almost constipation and diarrhea in terms of categorization, but in terms of implementation, the constipation and diarrhea have like an opposite guide. But in terms of grouping your points, you can easily recognize how to do that without any problems. Thank you so much. I wish you all the best for those who are going to do the new Osce. In case of any questions or any comments, just place them in the comment section. I'll always be responding to them. Wish you all the best, and bye for now.